न्यूरो ज्ञान यूट्यूब चैनल पर आपका स्वागत है। लेटेस्ट वीडियोस के लिए अभी सब्सक्राइब करें।
So, good afternoon everybody, and I am thankful to Niti Aayog and to Professor Dhamija for giving me this opportunity. Advocacy is a very broad term with multiple meanings and nuances for different stakeholders. And the cause for which advocacy is to be discussed today is promotion of brain health in India. Promotion of brain health itself is a very broad and multifaceted concept. It includes better brain health in healthy general population at all ages, prevention of neurological diseases, restoration of brain health in those suffering from neurological diseases, and rehabilitation of people disabled due to neurological diseases. Coming to the 1 and 2, better brain health, healthy lifestyle is applicable to all, not only brain health but every aspect of health, which includes nutrition, physical activity, sanitation. For example, neurocystic sarcosis and cerebral malaria, we used to see a lot about 3 decades back. Now they are much less. Vaccination and maternal and child health services. So all those things are applicable for healthy lifestyle for all, and they will promote the brain health also. There are many facets of advocacy. Advocacy about what? Advocacy about brain health in general, or it can be about stroke care or epilepsy care or some particular disease. Advocacy by whom? Advocacy by neurologist or by stroke survivors or patients suffering from a given neurological disease. They are also advocate. Advocacy addressed to whom? It is addressed to health policy makers, to the director health services, and to media. Advocacy for whom? For general public or various populations at risk for different neurological diseases. And advocacy how? By delegations, legislation, interviews, media coverage, lobbying, pleading, social activism. These are all many facets of advocacy. For me, the crux of advocacy is awareness and education, and there are many recipients and target groups for awareness and education. First and foremost is the general public. The other targets are patients and caregivers, healthcare workers, students, doctors, media, administrators. Regarding general public, being the recipient, it has to be through mass media. The messages have to be salient in the form of slogans or one-liners, or in the form of GIF images, or very brief animations, maybe on billboards, maybe on digital LED displays like we see in the airport arrival corridors. So this is how we go for the awareness and education. Who creates the content for general public about brain health? Neurologists. I have done a lot. We take the help of creative advertisers, and we can have crowdsourcing through competition and prizes. The rule of saturation level coverage should be applicable for mass media, for general public. And the examples are hum do, hamare do, polio, iodine, salt, and so many things. So similarly, the brain health related messages will be successful only if they follow the example of saturation level coverage. The content for health literacy related to brain health has to be created in Indian languages. Unfortunately, it is sparse in variety and depth. It is of variable quality. It is not widely available and nor widely accessible and not distributed well. As a national advocacy leader, I will execute many action plans to constitute a national committee of content creators to distribute the task of creating the content to neurologists and other volunteers, including patients and caregivers, to enlist the titles of write-ups, because the titles can go long way. Epilepsy is one title, but then epilepsy can have 20 brochures related to different aspects of epilepsy. And we will make ample use of arts and fine arts and humanities related content. We will take help of creative content writers, advertising and media personnel, translators, artists and literary authors. Here are some of the examples of the brochures created by me. for health education related to many neurological diseases. What should be the general messages for promotion of brain health? Like, neurological diseases are common. Many neurological diseases are treatable and preventable. Please consult a physician soon in case of listed symptoms. Never forget warning signs of stroke and reach an appropriate hospital. Learn the simple steps of first aid for neurological emergencies, and lifestyle measures help in promoting brain health. So those were the salient messages for general public. Now coming to the education and awareness for patients and caregivers. The message for them is, get educated about your disease. A lot of content is needed in Indian languages I have created. Learn to talk about your disease with confidence. Learn to demand best possible care. Become an active member of patient support group. I will come to that PSG in a few minutes. Take leadership role in patient support group and contribute to the content of health education literature, including your own narrative skills. I carry these type of posters in my clinic. Stories are welcome. Please tell or write stories about your own illness, and we need such stories more and more. Public service advertising and propaganda. This is something very important and we have not utilized so far in our country. There are many countries in which by law public service advertising and propaganda are mandated, and I am glad that in the November 2022, Government of India, Ministry of Information and Broadcasting issued an order about obligation of public service broadcasting, because airwaves and frequencies are public property and they need to be used in the best possible interest of the society. Public service broadcasting for a minimum of 30 minutes in a day on the theme of national importance and social relevance. And they have enumerated many things, out of which health and family welfare is a very important part. So we should utilize this rule, obligation of public service broadcasting, and not only for channels. I think it should be applicable to print media also, and this will help us in distributing the health education related messages. Polio vaccination drive, iodized salt, awareness about warning signs of stroke, persuading the bikers to use the crash helmets, messages about epilepsy. There are many messages which need to go, like epilepsy is common, it is treatable, it is non-contagious, it is not necessarily hereditary, it is not insanity, it is not incompatible with employment, marriage and parenthood. Similarly, messages about dementia, messages about learning disabilities and other neurological disabilities. The main attributes of a good public education are, it should be good quality, it should be abundant in quantity and flowing, and the size should range from few punchlines to a poster to a paragraph to a flyer to a couple of pages in a brochure to a booklet to a full-length book, and it should range again from basic facts, simple, to very complex. Never underestimate the intelligence and interest of the recipients. It should be in local languages, its layout should be of high quality, and it should be in print and digital format. Neurologists as advocates will do a good job if they prepare white paper. What is white paper? White paper is an official document on behalf of Indian Academy of Neurology or Neurological Society of India or Ministry of Health and Welfare about neurology in general and about individual diseases in particular. These white papers will be in all Indian languages and they will serve as a handy document while leading a delegation to policymakers, ministers, media people. And we have to identify the issues which will make a difference. Stroke care, IVIG supply, epilepsy OPD drug supply right up to primary health care center, Botox injections, plasmapheresis facilities in public sector hospital, orphan drugs. We all neurologists should become initiator, guide, catalyst and supporter of patient support groups. What can be the suggested content of a white paper on neurology as an ad for advocacy? The definition of the field, the community burden of neurological disease, the appallingly low ratio of neurologists in population and need for capacity enhancement, some scope of preventability of neurological disease, huge unmet need for rehabilitation and paucity of paramedic professionals, need for public health education. All these things will be highlighted. what do I expect from National Task Force on Brain Health? This is my dream, and it should be the dream of every neurologist in India. Following posts should be sanctioned for each of the 800 odd district hospitals in India: a neurologist, neurosurgeon, PMR consultant, palliative medicine consultant, physical therapist, occupation therapist, speech language pathologist, and a clinical psychologist. And following well-equipped, fully functioning departments at every medical college in India should have a department of neurology, neurosurgery, psychiatry, school of physical therapy, occupation therapy, speech language therapy, PMR, and clinical psychology and neuropsychology. And we need a national policy for promotion of patient support groups. We will define the patient support groups and their criteria. We will make a list of diseases for which PSGs will be recognized. We will define an outline of bylaws for PSG and an outline of government support to patient support groups, and they should be treated on the lines of cooperative societies. Some of the examples of advocacy actions which have been taken by patient support groups in many cities: they foster a sense of kinship and solidarity. They persuade the local and state health authorities to ensure regular uninterrupted supply of medicine. They act like lobbying to persuade local health authorities to make provisions for supply of relatively expensive drugs for poor patients like IVIG and TPA, to lobby for reduction of the cost of the drugs and devices with industry. So many action plans can be undertaken by patient support groups. And two departments. I wish Niti Aayog is able to use its goodwill in bringing together these two departments: the Department of Empowerment of Persons with Disabilities and the Ministry of Cooperation. If these two departments support the PSGs, the self-help groups, स्वयं सहायता समूह, वरिष्ठ सहायता समूह, विभिन्न न्यूरोलॉजिकल रोगों से प्रभावित मरीजों और उनके परिजनों का संगठन, यदि if we can treat them like cooperative with the help of Department of Empowerment of Persons with Disabilities, it will go a long way. Self-help groups which have been launched by me in city of Indore have been related to many neurological diseases. I have faced obstacles. It is not easy. Patients and caregivers are often not interested. They can't imagine how such groups may help them and others. They get bored. The challenge is to make the activities of PSGs interesting and look worthwhile, and that will happen if Government of India supports them on a policy level with the help of those two ministries. Then it will happen. Then one of the last points will be advocacy training workshops for neurologists and leaders of patient support groups. I have created syllabi. I have created training modules for potential advocates. And we should also have sheltered workshops at every district level. What are sheltered workshops? These are special places, special work environment which offer employment and vocational skilling for people with disabilities, and they gain some experience, they earn some money, and they increase their self-esteem. So every district should have a sheltered workshop so that the re-skilling of persons with disabilities can be achieved. So a few examples of legislation also. So legislation at state level and at national level can go a long way. For example, mandating the use of crash helmets, launching a national epilepsy control program. If Lok Sabha can pass an act for epilepsy control program, it would be great. If Lok Sabha can pass a stroke care act making provisions for emergency stroke care up to county level, district level, more scientific and updated definitions for various disabilities, mandating the establishment of district level sheltered workshop, so many things can be achieved with the help of legislation. So finally, what do I bring on the table? I bring health literacy content in Hindi, and I would like to emphasize that such content in any Indian language, Hindi and any Indian language, it would be much easy to get adopted and translated into other Indian languages as compared to if you start from English. So English to Bengali would be a bit difficult rather than Hindi to Bengali and something like that. I bring with me skills to create more content. I bring with me skills to build team of content creators. skills to launch and sustenance of patient support groups, and skills for advocacy training. So what is that I want to change? I want to make all stakeholders aware about the huge community burden of neurological diseases and the gaps in the implementation of what can be done for them. I want to arouse a sense of felt need and desire to. Unfortunately, that felt need is missing from the minds of neurologists, from the minds of patients, from the minds of family members. All stakeholders are missing that felt need. And I intend to kindle the dormant inherent skills of advocacy in neurologists and lay volunteers. Thank you very much. Thanks for your kind attention.